Hospital industry leaders say the latest version of Trump's Big Beautiful Bill dramatically limits access to Medicaid across North Carolina. It comes after Republican Senator Thom Tillis claimed more than 600,000 people stand to lose health care coverage. But as chief political correspondent Andy Weber reports tonight, several North Carolina Republicans still say they support the measure.
There's no other way to say it. It's a cut to North Carolina's Medicaid program.
A strong message from the group representing North Carolina's hospitals after Vice President J.D. Vance broke a tie in the U.S. Senate to advance the latest version of President Trump's Big Beautiful Bill. The legislation contains much of the president's agenda.
We're asking to basically just leave North Carolina's program as it is. If you want to rein in growth, like the United States House of Representatives did, we're okay with that.
North Carolina Healthcare Association President and CEO Josh Dobson says changes made and approved by the Senate would cut $38 to $50 billion in Medicaid funding over 10 years. The Senate's bill reduces taxes on healthcare providers. Without revenue from those taxes, states like North Carolina would be unable to both pay their share of Medicaid costs and qualify for additional Medicaid funding from the federal government.
This is not waste, fraud, and abuse. This is a cut to direct services to the people of North Carolina.
I think some of the concerns are valid.
Congressman Tim Moore, who represents parts of the Charlotte Metro and Western North Carolina, said he prefers what the House originally sent over to the Senate, but won't oppose this latest version.
But at the end of the day, I like so many, I'm going to vote for it because I'm going to stand with our president.
Moore shares the position of several North Carolina GOP leaders that the state itself will be able to find ways to adjust spending and make sure those who qualify for Medicaid can still get it.
Our legislative leaders who are in charge of the North Carolina legislature now have issued public statements stating that they believe that the state will be able to adjust their spending priorities and take care of those issues.
Senator Thom Tillis, a vocal opponent of the bill, remains opposed to it.
I've done what I'm going to do. I've told my staff I've rested my case. The fiscal research is out there. I'll leave it to the members of the House to decide how to act on it.
The House could cast a final vote as soon as Wednesday morning. Andy Weber, Queen City News.
Queen City News Plus. Just search Queen City News on your smart TV's app store.